everyone, I am Zev Myrowitz with Cape Chiropractic and Acupuncture, and I will be filling in for Dr. Kyle Nagel for the next several videos. At Cape Chiropractic and Acupuncture, we recognize that often when there's excessive tension in an area, it's primarily because there's some kind of biomechanical imbalance that can create a need for the body to grab and guard. And so when someone's getting a source of chronic tension in an area, it's important to identify whether or not there's a biomechanical cause to why this is occurring. Is that a protective measure? However, there's also this secondary reason why muscles can get tight all the time, and that's something called cumulative tissue injury. Our bodies are not perfect, and any kind of muscle, whether it's in your bicep or your legs or your glutes, is not made to contract forever. And if there are people who do things along the weekend warrior line where they tend to go a little harder than they should, and they experience a significant amount of soreness, or they have an activity where there's lots of repetitive micro-trauma and they don't make an attempt to help to just re-lengthen those tissues or do any kind of preventative care, you can often get this effect where the individual muscle fibers can start to become a little stuck and they won't want to lengthen to their normal distance that you would have in the rested state. So you develop this tonically shortened state where the muscles cannot properly lengthen and function. And that's what we call cumulative tissue injury. And so active release technique is extremely effective in helping to break up that scar tissue, but it's also important that we train different unusual stretches to target areas where people tend to have a lot of tension. So today I want to talk about a couple different muscles. The first one is a quadricep called the rectus femoris. You have 4 quadricep muscles. On the inside, the big one that you can see is the vastus medialis oblique. On the outside, the big thigh muscle, this one wraps all the way around towards the back, is called the vastus lateralis. On top is the muscle of interest that we have here called the rectus femoris, and then deeper to that is one called rectus intermedius. Now, the rectus femoris is a unique muscle because as a group, all quadriceps attach to the patellar tendon, which then ensheaths patella and then becomes the patellar ligament, which attaches into the front of your tibia. However, the rectus femoris has a unique origin where it also crosses the hip joint. So while all quads are responsible for helping to extend the knee, the rectus femoris is the only muscle that also flexes the hip. So people who have a running background or a cycling background or do anything where there's a lot of quad recruitment with repetitive microtrauma, if they tend to sit after training, very active parents, moms, athletes, they go through their different practices and then immediately go to car or work or wherever they're going to be, this chronically shortened state causes that muscle to start to tighten up. So it's important that we can recognize how to lengthen that individual quad versus all of the other quads as well. Now there are a lot of different quad stretches, and biomechanically this concept could apply to any of them. So a standing quad stretch is simply by taking the leg and flexing the knee, and that will lengthen the bottom quads quite effectively. However, the rectus femoris also attaches the hip, so you can target that muscle by performing something called a posterior pelvic tilt. So when you posterior pelvic tilt, the attachment on the pelvis migrates superiorly, and that helps to lengthen the rectus femoris, which also has that attachment. So to target the rec fem while performing a quad stretch, you go into your standing stretch, and then you hold that stretch, and then once you're really active, do a slight posterior pelvic tilt, and you'll feel a big pull in the proximal or the high up quad. Now that stretch can help to really lengthen these, and if you have a lot of buildup and you're having difficulty getting this area to open up, this is one area that you can focus on. In the next video I'll go over 2 others as well.